You know, Dr. Lipi Roy, this young man was a college student. You know, there are pictures of him, a big, strong kid. He goes to college, and in the interview with Eamon, you know, Mrs. Allen, Kelly Allen, talked about how her son's roommate had a cough, and that was the start of it. And soon she lost him. He's gone. He was 20. He was a kid. Can you just walk through for us, as a doctor, the irresponsibility of Donald Trump getting up in front of a crowd? Everyone in front of him doesn't have masks on. They put some people behind him with masks and saying nobody dies of this. Almost nobody dies of it who's young.
Well, Joy, this past week certainly has been an eventful one, hasn't it? It's a week where we saw, where we surpassed the somber milestone of over 200,000 lives lost from a largely preventable disease. 200,000, last I checked, is not nobody. Miss Allen's son is not nobody. 20 years old. And by the way, just yesterday, the day before, we lost Dr. Adeline Fagan, an obstetrics and gynecology resident in training who died from a complication of coronavirus, a hemorrhagic stroke. She was 28 years old. Not nobody, and certainly not just the elderly, not to diminish that, of course, either. This illness, this coronavirus pandemic, Joy, and we have talked about this for months now, largely preventable. At this point of the game, it's now September. We have been talking about this since March, April. At this point in the game, it's not the virus that's killing people. It's colossal failure in leadership. As you know, Joy, I'm right now in Canada visiting family. I'm quarantining as required by the Canadian government. Canada just reported last week, for the first time in 6 months, 0 deaths from coronavirus and maybe about 500 cases per day. In stark contrast, the United States is still averaging about 1,000 deaths per day and 40,000 new cases every day. Why do you think there's that difference? Canadians and Americans aren't that different biologically. It's about leadership. The Canadian officials, elected officials, defer to their health officials, and they advise masks. They advise distancing, these simple but effective public health measures that are keeping Canadians safe. The United States simply is not doing that.
Yeah, absolutely. And you think about, let me show you the lieutenant governor of Ohio, a state whose Republican governor has at least tried, to take COVID seriously. Here's his lieutenant governor getting booed for suggesting to a Trump crowd that they put on masks to save their lives.
But if you go into a grocery store where you got to wear one, all right? Hang on, just listen up. Just listen up. All right, I get it.
You know, Charlie, this is why sober and serious people are starting to refer to the Republican Party as a death cult, because they're booing the idea of saving their own lives and other people's lives. This young man was healthy and young and died. But even if he'd been a senior citizens, our grandmas are not nobody. Our grandpas are not nobody. Our elders are not nobody. So essentially, is Donald Trump saying, don't worry about it, it's only old people who are going to die? That's nobody. Because we're going to get to 378,000 people. Are Republican voters really writing those people off as nobody?
Well, first of all, I want to say that I'm really glad that you started the show with this, because this really is a tragic milestone. And what we're seeing right now in that videotape is an example of one of the most reckless moments in this reckless presidency. It's not just that Donald Trump has downplayed the seriousness of this, because we knew that. In real time, though, what he's doing is, instead of modeling empathy, he's modeling indifference. He's encouraging this politicization of masks and social distancing, and he's become a vector of disinformation. And I think that all of those things, not only look back on the epic failure of this country, which now has 21% of the worldwide coronavirus deaths, even though we only have 4% of the population. That number could double by the end of the year. So we've seen the failure, but what you are seeing right now is a president who, instead of providing leadership, is almost treating this like a joke. This is not normal. This is not politics. This is a failure. This is not just a failure of political leadership. This is a failure of humanity. So I think we do need to step back and imagine how this is going to look to historians who say, how did more than 400,000 Americans die? What were you saying? What were you thinking? And to have crowds show up and boo someone for suggesting the wearing of masks, even Trump masks, when we know that that's the one way of mitigating this. It's not nobody. There are thousands, tens of thousands, maybe hundreds of thousands of Americans who will die, who do not have to die. It could be mitigated by leadership. It could be mitigated by the mask, by the social distancing. And you're seeing the president who clearly is not looking out for us because he's pushing his own agenda, as Olivia said in the earlier segment.
I mean, and so you do have Cindy McCain is going to come out, by the way. I'm just going to stay with you just for a second, Charlie. Cindy McCain is going to formally endorse Joe Biden tomorrow. That's happening tomorrow. So you're starting to see Republicans who are, what is your fellow member of the Never Trump Republicans say their souls are coming back into their bodies and saying, I can't do this. Right. So you have a lot of Republicans who are trying to come out and help Joe Biden. Donald Trump is still, though, leading a group of voters, tens of millions of them, who now know that he said that they themselves are disgusting people that he doesn't want to have to go near. And he's glad he doesn't have to shake hands because he doesn't have to touch them. They're disgusting. They're like, yes, sir, thank you, but may I have some more? So I wonder how we get our public health back, even if Joe Biden gets back in office, because they're still going to be in Target coughing on things.
I do worry about that. I do worry about the attack on science, the attack on truth, the way it will spread this sort of disinformation and this suspicion. But, you mentioned Cindy McCain, and something rather remarkable is happening. You are seeing members of the Trump administration itself who are coming out and saying, look, we were in the room. This is what we saw, trying to warn the American public. Whatever you think about this man, this is who he is. So whatever happens on November 3rd, we will have been warned. We will have been told. And one after another, you're having other Republican leaders like Cindy McCain who are saying, look, we may agree with him on policy, but we don't share his values. And this is not a normal election. And I think that you're seeing their response.
And last question to you, Dr. Roy. People don't want to take this vaccine. The numbers are pretty stark. Only very or somewhat willing to take a vaccine, 39%. Not very likely at all, 53%. I'm sorry, it's 47%, very somewhat. 53% say nope. Are you concerned that even after Trump is gone, people will be so afraid of taking a vaccine he had anything to do with that people won't be willing to take it?
Yeah, there's a legitimate concern, Joy, that's in some ways a lot of damage has already been done by the narrative, by the false messaging, by the misleading messaging. And by the way, when the president says he just wanted to downplay, let's call a spade a spade. It's not downplaying; it's deliberately misleading and lying to the public. And this matters to doctors and healthcare professionals when you're talking about life and death. So let's be very clear. He knew what he knew when he knew it. And if we disseminated this information about preventive health measures months ago, we're talking 150,000 lives easily saved. Regarding the vaccine, again, the concern right now, Joy, is that none of the companies have completed phase 3 trials. Even if, say, by December, that's some of the conservative estimates, even then, yes, they'll have tested a larger number of people, but we just don't know how effective or what the adverse events will be. We'll have a better idea in December, but remember, historically, every vaccine takes 15, 20 years. So for us to just ram this through less than a year, I'm not surprised by the public's skepticism, to be honest, Joy.
Yeah, they're wise. It's wise skepticism. Dr. Lipi Roy, Charlie Sykes, thank you, my friends. Really appreciate it. And up next on the ReidOut, speaking of what did he know and when did he know it, Bob Woodward joins me on how Trump, to this very day, continues to deny that COVID is a threat, even though he admitted to Woodward that he knows better, as he spreads disease and misinformation at his rallies. And the Republican Supreme Court hypocrisy. Hey, Democrats, don't get sad, get mad, and make them pay in November and beyond. Senator Doug Jones of Alabama joins me. Plus, the growing threat in Pennsylvania that as many as 100,000 mail-in ballots will not be counted, and what can be done to fight back. Back with more of the ReidOut after this.